What's been happening with me with the cancer, I've had it since 2019, is that I'd go through the different chemos and it would take away the cancer, but then it would show back up. I wanted something that will take away the cancer and keep it away, of course, and to live my normal life a little bit. Things have changed, but it's just, I want to be able to do the things I want to do right now. At least a halfway normal life is the best way for me to put it. So I hope that made sense what I just said. The group here is just wonderful on how they treat you. We ran into some complications, side effects I got. Taking the pills at first, they didn't agree with me. And so they put me on some medications and just worked around those medications to see which one would work. They took me as an individual, like, okay, we need to get you feeling better with this. And that was the biggest thing, because nausea is no fun. And nothing else. I mean, I've lost weight, but I plan on putting that back. I get my chemo, and I see the doctor every 2 weeks. And they have always a doctor there for me. I get an EKG, then I go back and get my chemo. And before then, we always go over our talks of what questions I have, what's going on, how are my results of any test taken that week. Then on other weeks, I could get a CT scan, a PET scan, and electrocardiogram. So I'm a little bit busy some of the time. And right now I get a little low on magnesium, but I just get infusions with that. And I'm fine. I'm good. I like how, I can find out anything I want. The pros are from any of the people with the staff, with Dr. Alliant's staff, or I can go to Looney and I can find out what I need and what I don't need, or any type of questions I have. The cons, I think at first, because there was so much going on, there was sometimes a little bit miscommunication, but it's all been worked out. They've worked on it and they've improved everything, so I can always find out from them what I need. And that's important, to look at you as an individual while going through this. They make phone calls to me or text me, and I like that, that I just needed to talk to them for a minute. Sometimes, like when I had the side effect of the nausea, it was bothering me a lot. And so, yes, I had to make some phone calls and, okay, this is bothering me, what can we do? But everybody worked together, the doctors, Looney, and they worked it out. If something didn't work at that time, then they find something else for me. So I don't know, I think mostly it's positive, even though you may have a con with it, but it turned into a positive. She's been great of the times I've met with her, and cares about all her patients. I can just see it, when I met her. And she is very upfront, and I can ask her any questions and get a matter-of-fact answer back. And I like that. That's so important when you're going through all this. So it's good.